Hello and thank you to inVIVO for having me. I'm Jessica Burt, a final year medical student at the University of Leeds, and I'll be talking about the resilience to the health impact climate change in rural British Columbia, a comparative policy analysis. This was conducted with Interior Health under the supervision of Jason Curran. I would like to acknowledge that this research was collected and conducted on the traditional and unceded territories of the First Nations of Ktunaxa, Shwepin, Okanagan, Haida, and Williams Lake. Rural communities in BC encompass a wide range of people, places, and qualities. The provincial requirement for all communities to include greenhouse gas emission reduction targets in their official community plans provides an opportunity for community transformation and climate action. Framing this in resilience looks at the ability of a community to withstand the negative impacts of climate change without impacting on the population, quantified as the product of adaptive capacity, persistence, and transformability. The aim was to analyse current resilience to health impacts of climate change through publicly available official community plans in 4 communities, identifying areas which fostered or inhibited resilience. This was conducted through a comparative policy analysis based on looking at fact-based goals, policies, implementation, health and framing, in addition to comparing contextual demographic profiles. The communities ranged in size from 779 to over 10,000. The first was a wealthy community reliant on carbon-intensive industries, the second a smaller agricultural community, the third a larger rural centre with a high population density, and the final a small coastal village with a large First Nations population. The first OCP, developed with Columbia Basin Trust, looked at health and policy areas well. Climate change was locally relevant with an energy emissions profile and short-term reduction targets. Clear community adaptation goals were identified, which included health co-benefits of active transport and the impacts of wildfires, and a strategy was available. The second had a good range of greenhouse gas emission goals and policy areas covered, but little explicit inclusion of climate change or health. It focused on the protection of agricultural lands and current practices, suggested the development of an energy benefits of active transport. The third looked at the impacts of the changing climate specific to the setting with health impacts. Mitigation policies focused on infrastructure and external collaboration with a larger focus on local food production and delivery, linked with food insecurity and quality of life. Social well-being and ecosystem services were recognised as an important reason for mitigation policies. Developed with Whistler Centre for Sustainability, the link between environmental well-being and health was discussed throughout the final plan. A recognition of key areas of emissions, a climate glossary, and community adaptation goals were included with a focus on local food production and individual and community health. Plans and implementation guides were available. It's evident that the provincial mandate for greenhouse gas emissions is successful in starting climate action, but this does not foster resilience. Active transport is a clearly recognised and focused on health co-benefit of mitigation. Local and sustainable food production is also an adaptive mechanism covering social inequalities and quality of life in sustainable transformation. The wider recognition of environmental drivers of health and well-being is more to the larger Indigenous population, highlighting the importance of recognising Indigenous ways of knowing and being within community transformation. Only those which partnered with external organisations had clear adaptation goals and thus greater adaptive capacity. And finally, implementation remains to be seen, but it's clear that local ownership is important in continuing momentum and ensuring that these are put in place. The approach taken by communities clearly influences the planning for transformation and resilience, with those able to engage with wider partners more successful. The health impacts of climate change are considered in any climate action, but social factors which facilitate adaptation better protect wider health and well-being of the community. Thank you, and here's some information to find out more.